Welcome to Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. And I'm your host, Alicia Taylor. Welcome, listeners. Hi, Doc.
Hi, Alicia. How are you?
I am doing well.
Hi, listeners.
Listeners, today we're going to be talking about cardiac rehabilitation. I'm very interested in this one, so I really want to hear what Doc has to say. But remember, you can check out our social media pages. On Instagram, it's Rehab Institute Caribbean, or Dr. Paula Dawson, or Alicia Taylor Music. For Facebook, we have Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com.
Yes.
Great. So where do we start? Tell us a little bit about cardiac rehabilitation, or if you want to tell us about the cardiac system. I say it name?
I like that. Cardiovascular.
Sorry, cardiovascular. Make a note of that right away.
CVS, cardiovascular, not the pharmacy.
CVS, okay.
Cardiovascular system. So the cardiac muscle, or the cardiac, we refer to the heart.
Yes.
So the heart is really a muscle that's located in your chest, on the left side, just to the left of your chest.
Left side, strong side.
Mm-hmm. And it pumps blood around the body. So that's why it's an important muscle, very, very important muscle. And sometimes, of course, if it's a muscle, it's going to need to have blood going to the muscle. So the coronary arteries will take blood to the heart muscles. So even though the heart has a lot of blood flowing through it, that blood doesn't supply the heart with blood to function. So the heart muscle must have a separate vascular system taking blood to the heart muscle, and that's a coronary artery system. So in some ways, they have a coronary artery attack or coronary bypass surgery, CABG, coronary artery bypass surgery, CABG. That's the acronym CABG.
I can't believe it.
Or they have coronary artery stenting, where they put something in the coronary artery. And why do you think they do that? No clue?
I don't know. I try hard, Doctor. I tell you the truth. I don't know.
So the coronary artery, as I mentioned, is an arterial system that carries blood to the heart. And sometimes those arteries might get blocked up, where they get atherosclerosis. We mentioned that before, where you get hardening in the artery. So fatty buildup and a plaque on the inside, and it narrows down, and it prevents blood from going to the heart muscles. And sometimes you can feel that as chest pain, and that can be called angina.
Yeah.
But when it gets to the point where that narrowed coronary artery is so narrowed down where the blood no longer flows to the cardiac muscle, whether from complete occlusion, maybe from a clot buildup, you get a myocardial infarction, a heart attack. That's what a heart attack is. And so there are other things that can happen to the heart. The heart can get overworked, and you can get congestive heart failure, where you just kind of get weak out, the muscle just weak, and it can't barely pump the blood around the body.
But the heart get overworked?
Well, just like your muscles, it needs to be maintained in terms of your exercise, which is why you have to keep the muscle strong. So after a while, one, if you're deconditioned, your heart muscles get weak. But also, if you have continuous high blood pressure and you don't control the blood pressure, it kind of stretch out the heart. You get dilation of the heart, cardiomegaly. And then when the heart, in that type of cardiomegaly, because you can have another type of cardiomegaly. So after that point, when the heart is completely stretched out, it kind of get weak. It's like when you have a balloon, and when the balloon is new, it kind of recoil. But when you stretch out the balloon after a while, you can't really get it to come back on its recoil. And so the question is, once I've had a heart attack, a myocardial infarction, or bypass surgery, or there's something called angiogram. An angiogram.
Tell me about an angiogram.
So an angiogram is a study that you do to look at how open the coronary arteries are, to make sure that they're nice and patent, meaning clear. So they're not clogged up, for want of a better description.
How do you do this test? Is that the one from the groin?
Very good. You can do it from the groin, or you can do it from your wrist. Right, where you have the artery at your wrist, you can actually do it from your wrist, and you send a wire.
And it goes to the heart?
All the way close to the heart, and then they'll use a contrast, which is a dye, and they squirt the dye into the coronary artery, and then you can see the flow through the heart. So if there's an area where the vessel is narrow, you'll see like either the dye you don't see it on the x-ray machine because it's done on the x-ray guidance, or you see a thin line. So you'll see like a nice round, like a line where the flow is going, and then there's no flow, and then flow again. So that's how you know if the coronary artery is stenosed.
You don't just get up and do an angiogram.
I like that question, you know why? Because you don't. And so you do an angiogram when you have signs and symptoms that may suggest coronary artery disease.
Okay.
And so you may have chest pain, with exertion. You may have changes on your ECG, which is an echocardiogram. In America, they call it EKG. Same thing, British ECG, EKG. Or, you can have an ultrasound that shows abnormal movements. An ultrasound, which is an echocardiogram, where ultrasound, sound, echo of the sound, which is used to show the area. The areas in the heart. And it can look at the valve, and it can measure the thickness of the muscle, and it can look at the flow. And so when you have all of that, you're able to, when you do the angiogram, you're able to see. Now, if there's any narrowing, they can actually put a stent in it. A stent is like you remember first time those clicky pen?
Yep.
And when you open the pen, you see that little spring?
Yeah. No,
so a stent is really like that. So they put the wire all the way up through. It's not open while it's going through the blood vessel, but once it gets to the area of narrowing, then they deploy it, and it just opens out, and then it opens up the lumen. That's what people have stenting.
Oh my God.
So stenting can prevent you from having the need to do a bypass surgery.
Yes.
And what is a bypass surgery?
Tell me what a bypass. Tell us what a bypass surgery is.
I'm going to tell you. We need to bring a cardiothoracic surgeon here. We have some nice, amazing ones in Jamaica. But a bypass surgery is if the blood vessel is completely blocked, which is one of the coronary artery, then they'll take a blood vessel, usually from your leg, like a vein, and they bring that vein to the heart and bypass the blockage. That's really what it is.
But, okay, so how them get it? Them do the same...
Man! Oh, I love the fact that you asked that question. They do a sternotomy, a big incision down
How do I have to open it?
your sternum, the chest, and they open up your chest, and they go into the heart, and they'd have to do... That's called open heart surgery.
Open heart.
We have some amazing surgeons that do open heart surgery, and patients do so well. So you can have a double bypass, which is 2 blood vessels, triple bypass, 3, and quadruple bypass of 4 vessels.
It's not 3 tired going on my chest though.
No, it's 3 different areas of the...
3 different. I just want to make sure.
Yes.
I don't know.
Yeah. And so the question is, if you have a heart attack, do you need rehab?
Do you?
Yeah, you do. Yeah, you do. But it's not only heart attack people need rehab, or people who have, which is not... So people who need cardiac rehab...
Tell me.
...would be those after a myocardial infarction, a heart attack, or after the CABG, which is the coronary artery bypass grafting, the G's for the grafting, or after angioplasty. So the angioplasty is the stenting, where you go in and you put in the stent and you kind of open it out.
Okay.
Patients who have other coronary artery disease like congestive heart failure. Yeah. Some patients that have pulmonary restricting disease also need it as well.
Okay.
Why?
Why them need
Because the heart has to pump blood to the lungs to get it oxygenated. But if the lungs is stiff, then the heart has to work harder. So sometimes you have like restrictive, where the lungs just get kind of tight up, and it's not like spongy, allowing the blood to flow. So the heart has to work harder to push. They call it pulmonary hypertension. You have to push the blood more through the lungs to exchange the carbon dioxide for the oxygen, and it comes back to the heart. And then on the left side of the heart now, it's pumped to the rest of the body.
All right, so okay, that's clear. So we talk about persons who have had a heart attack, or
Right.
the cabbage thing,
Right.
stenching and stuff.
Yes.
What about persons who just have consistent or persistent palpitations, like heart palpitations? That's not necessary.
No, not at all. The question is, what
Okay.
is palpitation?
Yeah,
And the
okay.
reason I like that question, because palpitation can be just regular. If you drink a lot of coffee like me,
Yeah,
you
you
can
will
get
have.
palpitation. If you're anxious, you can get palpitation. So palpitation is a normal skip of the regular sinus rhythm. The sinus rhythm, but it's not sustained. You can get it if you're anemic. You can get it if you're nervous.
Oh.
There's some diseases that can give it to you, like thyroid disease. And so different things can give. So it's a quick, irregular heartbeat. more common when you're under stress. You can get a lot of palpitation. So that's an irregular heartbeat. But then you have other irregular heartbeat that we call arrhythmias.
Yeah.
Those are where you would need medication to correct them. Or when the heart, like for example, if you have a heart attack and you're recovering, sometimes a heart attack where the heart is beating so fast that it doesn't allow time for the heart to pump. And so that's what they call your fibrillation, where it's going so fast. And that's when you see them get the shock the thing and they clear and they kind of reset. So you can use that to restart the heart or to reset the rhythm. So sometimes you can have, when you watch TV, you see how you see the rhythm is too fast, or if they're flatline, so it can use to restart the heart, or it can use to correct the rhythm, to bring it back into sinus rhythm, which is a regular QRS rhythm that we see.
What if you can't actually feel the... I don't know what I ask, because I don't know if this is the heart. But what if you can feel the pulse? What is it?
The rhythm, the irregular rhythm?
No, man, not the irregular rhythm. Yes.
You mean the shock?
It feels like if you put your hand under your chest where your heart is supposed to be.
The pulse.
Right, and you can actually feel it. Like you feel like it's your heart. You feel a pump.
All right, so you can actually feel the beating of the pulsation of your heart.
Pulsation.
If you're thin enough. But interestingly, just below the heart, going down in the back of the abdomen, you have the aorta, which is a big blood vessel that comes from the heart.
Okay.
And so the aorta pulsate.
Yeah.
But you can have an aneurysm of the aorta, which is where the aorta now dilatates. So it's no longer pulsating. It expands. It's expansile as well. And so that is a different story where with aortic aneurysm, where it's really the walls of the blood vessels stretching out, those patients, you can have dissecting aortic aneurysm, and it's a surgical emergency because you can bleed to death literally inside. So that's a big topic. We should probably discuss aneurysm, because remember when we did stroke, we spoke about berry aneurysm, which is really just a dilatation of a blood vessel, but the aortic aneurysm is bigger. Someone and the fact that you mentioned that if you have had aortic aneurysm surgery, you should do cardiac rehab as well. Very good, very, very good. And so the irregular heart rate that you get, arrhythmias, those patients can be on a lot of medications that can help to correct the rhythm, right? And that will kind of bring the cardiac muscle back. But cardiac rehab is really a monitored set of exercise where we look at your nutritional needs and your nutritional counseling, emotional counseling.
Because that's important for the heart.
Right.
Man!
Yeah.
I like this.
You do.
I do. I love this.
Right.
But we're gonna have to take a break. But when we come back, we're gonna get more into all of those steps. Would that be considered like an algorithm or no?
There is an algorithm. There are phases to cardiac rehab. So
come on.
It's either 3 or 4 phases depending on what system or protocol you're using.
I'm learning.
Yes, you are.
I'm learning. Stay with us. We'll be right back. Welcome back to Rehab Now. If you're just joining us, we're talking about cardiac rehabilitation, and Doc has made me, know that we're not reach cardiac rehabilitation yet because we're still there and talk about the heart. But what we're gonna do now is we're gonna actually talk about cardiac rehabilitation. So what is that, Doc?
So cardiac rehabilitation is actually monitored exercise with nutritional counseling and emotional and educational support.
Good.
And so the patients that I mentioned before, they will need it. And why do we do this? Why we do this? One, to improve or maintain a good level of cardiovascular fitness, right? You want the patients to regain their strength. You want to prevent any worsening of any underlying condition, and also to prevent the cardiac event that happened in the first place.
Yeah, okay, good.
So these are the main things that you want to do. So you have the different areas. You have physiological, where you have to look at the function of the heart. You have psychological, which is very important. Social is important as well. Social, of course, because once you've had a heart attack, sometimes you're afraid to go outside. You don't want to walk. You're afraid you're going to get another heart attack.
Yeah,
right.
yeah.
Then you have vocational, because once you've had a heart attack, once you've had a cardiac event, let's not just call it a heart attack.
Okay.
Once you've had a cardiac event, whether it's surgery, a heart attack, or congestive heart failure, you may not be able to do the same job. For example, when you do heart surgery, there's a big incision that you get done by your chest, and so some of the upper limb strengthening exercise, what is the type of, not strengthening exercise. If you had a job that you did a lot of manual lifting and pushing and pulling,
You can't do that
you
again.
may not be able to go back to that again without proper cardiac rehab. And then, of course, you have the emotional status, the emotional part of it.
Yeah.
Now, you know, when it comes to cardiac rehab, we usually have like 3 or 4 phases depending on which one of the categories we're talking about. But before I get to that, I want to talk about something called metabolic equivalent.
All right.
Right? So the metabolic units, we call it the MET, right?
That
So
sounds easy.
MET, M-E-T, MET. So MET is the unit of how much energy you use when you're sitting down doing nothing. That's 1 MET.
You use energy when you're sitting down doing nothing.
Right. So you have
You
to
learn something new every day.
because you have to breathe. And you ball off for work. You have to see everything because you're not dead. So you have to use some metabolic. So you have to be
passive, but
using up some oxygen when you're sitting down. You're still using oxygen when you're sitting down. So for example, so you have different METs. For example, a slow walk, which is about 2 miles per hour, is about 2 to 3 METs.
Okay.
A brisk walk, which is about 4 to 5 miles per hour, is about 5 to 6 METs. How fast do you think you're saying run in terms of miles per hour?
Oh God, could I tell me,
27.33 miles per hour. I looked it up. Usain Bolt run, if you were to calculate it to how many at the speed he runs at 100 meter, he runs about 27.33 miles per hour. A jog, when you're jogging,
that guy is
it's 5 miles per hour. Right? But then it doesn't have to only be exercise. For example, if you're mopping the floor at home, it's 2 to 4 METs. And the reason I'm saying this is because the amount of energy you expend after a cardiac event, we will tell you how much METs you can use, how much the heart is going to work. So to go outside and mow your lawn is up to 4 METs. Climbing stairs is up to 6 or 7 METs, right? And so, you know, if you can climb a full flight of stairs without being out of breath after cardiac rehab, you know, I'll tell you what that means, and some people will find that interesting afterwards, right? But let's come back now to the phases. So you have phase 1, which is right after you have the cardiac event and you're still in the hospital.
Okay.
Right, so you're only allowed to exert like 1 or 2 METs in the acute phase. Right, so at that point, you know, if you had a open heart surgery, they'll give you a pillow. When you're coughing, you're squeezing the pillow, and you're just doing basic stuff. You can do a slow stroll. Right, and that's usually anywhere between 1 to 14 days when you're in the hospital.
Like getting up to use the bathroom.
And I like the fact that you say that, because it's better to get up and use the bathroom than to use a bedpan.
Okay.
Because when you're using a bedpan, you have to bridge, and that uses a lot of muscle energy. So you have to really take your time and turn, get up. You might have a commode at the side of the bed and you sit on the commode, not the bedpan. I'm glad you mentioned that. So when I did rehab overseas, you know, people say, can I just use a bedpan? No, you use more energy to use a bedpan than you do to take your time and turn and get up and sit on the commode. Interesting, eh?
It is, because you don't ever dream.
Right. So then after like 14 days, you have the outpatient. And here we gradually increase your level of activity. So you're going from the 1 to 2 METs up to 3 to 4 METs. And then phase 3 is where you do more like maintenance exercise. And then phase 4, some people stop at phase 3, but phase 4 is like, you know, high-end maintenance where you go to the next level. Now, I mentioned to you climbing a full flight of stairs. Patients ask, what can I do? Can I go back to having sex after heart attack?
That's the question.
And we usually tell them, if you can climb a full flight of stairs, you can with a familiar partner. It has to be a familiar partner, because outside of that, you might get too excited and you might pressure the heart too much. Right?
Interesting.
Yes.
So, okay, let's say someone has had a heart event.
Yes, cardiac event.
Cardiac event.
Heart event can work.
All right, cardiac event.
Yes.
And you know, before the cardiac event, you were able to do like a whole lot of things. How after the cardiac event, how much has that been decreased? Or how significantly has that been decreased?
That's a good question. Why? Because it depends on what the event was, and not what your cardiac function is. All right, right. It depends on what your cardiac function is. So you have to look at the blood pressure. You have to look at the motility or the mobility of the heart. For example, if you have had a coronary event, meaning the artery has occluded and you have a myocardial infarction. Myocardia means myo muscle, cardia, heart muscle. Infarct means there's no blood going to the area.
So that's a heart attack?
That's a heart attack. So essentially the cardiac muscle dies because it becomes ischemic. There's no blood going to it, so there's no oxygen. So the cardiac muscle dies. So essentially when you get a heart attack, the wall, they call it the mural, the cardiac mural, that area where you had the heart attack, is no longer pumping.
Yeah.
So that part is not moving and the other part has to move. Well, other parts have to move. And so depending on how big, it's just like a stroke, depending on how big the mural and where in the heart it is. So you can have left-sided heart attack, right-sided heart attack. You can have the septum.
Gosh.
Yes, you can have the septum, which is the middle, like the middle muscle that separates the right side of the heart from the left side of the heart. And so...
Oh, so off the heart. Because me, I think left side, right side. Okay,
yes.
Great.
So we're looking at the muscle. So it's what part of the muscle in the heart is damaged. So you can even have a heart attack that might affect, because remember the valve is a muscle too. So you can have valvular ischemia, and then one valve stop working, and then you get regurgitation. So you're pumping the blood, but every time the heart contracts, the blood back flows instead of the valve doesn't close. So a valve is really to prevent backflow of blood. Yeah. Just like when you have varicose veins, essentially the valves in the veins are incompetent. And so you get backflow, and then the blood, instead of flowing one direction, the blood kind of settles in the vein, and then they get tortuous, and you see those little dilated veins.
I've seen them.
You have seen them. Right. And so the question that you ask is, how can the person go back? It depends. Our aim is to try and get them back to maximum functionality.
Yeah, within the limitation.
I like that, the fact that you remember that. So, and also we want to reduce the risk of having another event.
Right, because they can.
They certainly can.
It's easier that way.
It's easier. It is, because whatever the atherosclerosis set up, meaning the fact that you had coronary artery narrowing in one vessel, it's likely that it might be somewhere else.
Jesus.
Right, because it's a dietary thing. So remember, one of the first things that you can do to prevent another heart attack, stop smoking.
Okay.
If you're a smoker. Control your blood pressure. Blood pressure is important to be controlled. If you're diabetic, make sure your glucose levels are controlled. Exercise. And exercise is always important. And one of the things I want to talk about is what is the best exercise to do? Right? And so the Ministry of Health, just like the WHO and all the other cardiac association, heart associations, they would recommend that you do like 150 minutes per week. Well, you can stretch it out.
150 minutes, got
per
it.
week, yeah, between 120 and 150. So you can do 30 minutes, 5 days per week.
Okay.
Right?
All right.
Or you can do 20 minutes, 7 days per week. Right? So 2 sevens, 140.
Not
or
bad.
3 5s, 150.
Work out every day.
But here's it. It has to be, it can be low intensity, because you have low intensity, intermediate intensity, and vigorous. So it has to be the middle one.
Oh.
So you have to be at least a brisk walk.
Okay.
It can't be a slow stroll.
Okay.
It has to be a brisk walk.
That no count.
It does not count. And so, the Ministry of Health would suggest that, fitness is always important. Yeah. Exercise. You have to exercise. In fact, I was watching something the other day. Did you know if you walk every day, it helps your memory?
You look like I walk. We need to start to walk.
But you can't remember to walk. Because you're not exercising. Yeah, walking actually helps your memory. And of course, it helps everything. It helps muscle strength. It helps cardiovascular. It helps
circulation.
Your mood. It helps
everything.
It helps emotions.
Walk.
So you have to walk. So, but it's not a slow stroll. You have to at least do
walk fast.
3 to 4 minutes. You don't have to do the 27 miles per hour.
No, we're not. Usain Bolt.
You just do like a 3 miles per hour walk, which is like 3 to 4 minutes. A brisk walk, right? You do have
Just
to walk.
think about the brisk walk alone, let me tell you.
Yeah. But you know what? Once you start an exercise program, then you have endorphins. That's sweet, nice.
Yeah.
Endorphins.
Yeah.
What are endorphins?
That look at something that we releasing in your body.
The
That's
nice chemical.
chemical.
Make you
that
feel
I try to
good.
remember. Chemicals. Yeah.
That you release. Endorphins are kind of good. So, guys, if you're listening, and when you're exercising a lot, your body releases endorphins. They're like feel-good chemicals in the body, make you feel nice and. So, cardiac rehab is important. And prevention is always
better than cure.
And so you should really and truly be doing exercise 150 minutes per week. So whether it is 30 minutes, 5 days per week, or 20 minutes, 7 days per week, at least a brisk walk. So you have to get your heart rate up. And that is just like the muscle. When you curl at the gym, you have to do resistance exercise.
Resistance training, yes.
But you can't do that to your heart because you can't put a dumbbell for your heart.
No.
So you have to run and make our brisk walk so your heart beats fast. And the faster it beats, is the more you're working it and the muscles will get stronger. Remember I told you athletes have, when you look on the echo, their hearts are actually bigger because they're working.
Yeah, they might work it. They must strong up them heart muscles.
Strong
and
heart.
stuff. Love it.
Yes.
Wow. Thank you.
You're welcome.
So much, Doc. I mean, we can't believe the time up and we really not even touch half of the things that we wanted to talk about.
We have to bring it back again.
And we bring who we bring like a cardiologist or like a cardio something other
We
person?
could actually have a physical therapist doing the actual cardiac rehab, and then we can probably have a cardiothoracic surgeon who.
All right. What about? Thank you so much for joining us on Rehab Now. That's all we have time for. Thank you to the sponsors. That's Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. Thank you to Power 106, our show producers. And the Rehabilitation Institute of the Caribbean is located at Suite 280C, Ligonier Post Mall. Give us a call. I will see you all next week, same time, same place. Blessings.
Almighty Studios, your recording studio, a place to praise, to worship, and to serve. Welcome to the new normal industry standard. We are where you can come to worship and rehearse, record, mix or master your music. We have all you need to create your best production, including beat, song, podcast, commercial, and whatever you can ask, think, or imagine. Book your time today at Almighty Studios.